Welcome to the Posture Podcast. I'm your host, Dr. Spence, the Posture Doc, coming at you with over 20 years of clinical experience helping people who have been injured in a car crash. Now, one of the things that we focus on almost exclusively within our practice is helping people who have been injured in a crash that have damaged the ligaments. And one of the things that we learned is that there's really three main levels of ligament damage that we can talk about. Now, level one is what everybody knows as a sprain. This is very common. You've sprained your ankle before and you don't want to walk on it because it hurts. And because it hurts, you give it a chance and it heals and all things are good. Level two is when we get into a micro tear. Now, as you can imagine, with the word micro, we are actually starting to think about small tears. Here's the problem with small tears. A small tear is still considered a permanent injury. And I'm going to circle back to that one in just a little bit. And we're going to talk very specifically about what a permanent injury means. And level three is a macro tear or a large tear. Now, usually we get into things like complete tears or ruptures. And in these situations, they are usually a surgical repair. Now, that doesn't necessarily happen or help if that macro tear, if you want to call it that, in the neck takes place, because we're talking very, very small ligaments in very, very difficult to reach areas. So usually what happens is they surgically fuse the bones together if you've had a macro tear. But a micro tear is kind of where I want to put my attention today. Now we can touch a little bit into the world of the macro tears a little bit. But I want to talk specifically about what this means. First off, if you have a micro tear, it is still a tear. Now, why did I say permanent? Because permanent means that if your body does not have any type of an outside force coming in and helping your body to actually repair, that it usually doesn't repair. And the reason behind that is because there's almost absolutely no blood flow that goes to the ligaments, and because there's no blood flow going to the ligaments, there isn't any rebuilding tools that can be brought back to that area to help the body to repair itself. And so because of that, you have now what is considered permanent. It is something that will be with you for the rest of your life. Now, in a little bit, I'm going to talk exclusively or specifically about how you can actually live a normal life even though you have a permanent injury. All right, so let's dig into the causes of these macro and micro tears. Now, sprains, those are kind of self-explanatory. You rolled your ankle, you got your wrist bent up. These are things that typically will cause a sprain. But when we start talking about tears, we have to understand that a ligament is incredibly strong. And so for it to be torn, you have to have a force that is pretty significant. So let's go to the world that I typically dig in, and that is the car crash world. You wear your seatbelt, at least hopefully you do, and that seatbelt comes across your body and it anchors you in. And if you are ever in a crash, the purpose of the seatbelt is to restrain you against the seat. So there's not a lot of movement of the body. The problem is that your head does not have a seatbelt. Now in racing, they have this thing called a Hans device. And a Hans device is something that goes over the racer's shoulders, and it has these straps. The straps actually connect to the helmet, and the device itself is anchored in by the 5-point harness that they're wearing. It is one of the best things that can happen and has been invented because it protects so many people from damaging the ligaments. But let's be honest, nobody out there wears a Hans device just by driving around. You don't see it. And if you do see it, you might want to be a little concerned because they might have something under their sleeve about what they're trying to do. But because you're not wearing a Hans device and you're not wearing a helmet, we then have to dig into your head. How much does your head weigh? Now, the average weight of a head is about 10 pounds. Yes, some larger, yes, some smaller, but they say the average is about 10 pounds. So if you have a 10-pound bowling ball sitting on the very top bone, which is about 2 ounces, and you have your body restrained, but nothing's holding that head, and you get into a crash, that head's going to go whipping around. And the force of that, the sudden change of velocity, known as the delta V in the car crash world, the delta V, if it is a very big number, the change of velocity is from 75, 80 miles an hour to 0, like that. You tend to have a very quick whipping of the head. And that's what happens and why we call it whiplash. Now, whiplash by itself is not a condition. It is actually an event. So if you have whiplash and the head goes snapping around, you have a tendency of actually damaging the ligaments that hold your spine together. Now, since the fact that you have a 10-pound head and you only have very specialized ligaments, you have 9 specialized ligaments per joint, 8 of those protect going forward, 1 protects going backwards. Most of the time when somebody has an injury, it's from either being hit from behind, your head goes whipping backwards, or there's the initial whiplash that goes forward and then your head comes this direction. That's the history. That's how things happen in a car crash. But a car crash is not the only way that somebody can actually damage a ligament. Unfortunately, we have this terrible thing called domestic violence. Now, this is unfortunately probably a much bigger reality than most people realize. And those that have endured a domestic violence situation, you are amongst many, many people. And for that, my heart goes out to you. I am sorry that this has happened. But we have to talk about what happened to you, not the event, but physiologically. When we start talking physiologically about what happened to you, now we have to look at the damage to a ligament. And then we have a damaged ligament and we have a 10-pound bowling ball, and you lose the posture because muscles become weak and we have bad habits like being on our phone. Then the tendency is you go into this avalanche slide. The head and the neck just kind of drift forward. And the more that it drifts forward, the more you're putting direct pressure onto the ligaments that hold everything together. And if you have that extra pressure, you now have inflammation. This inflammation is going to create an increase of pain because the inflammation is putting pressure right on the nerves. Unfortunately, the longer that somebody has inflammation, the more the development of arthritis becomes a reality. And we know, the research shows that if you have a bad posture and your head's gone forward and you have a thing called forward head position, that it's not a potential that you're going to develop arthritis. It's a reality. It just is a matter of when that's going to happen. So if you have any type of damage to the ligaments and you do not do something to help to stabilize that, then that is your outcome. That is something that you have to look forward to. Not very exciting, is it? But this is where we come back to where I said I was going to circle back around. Just because you have a permanent injury does not mean that you have a permanent symptom. The body's amazing. We have this wonderful built-in redundancy system. It's a backup system that actually helps to support the ligaments when they're not doing their job or incapable of doing their job. And that redundancy system is actually the muscles within your body. And if you do not have strong muscles within your body, then you actually don't have a third line of defense. There isn't anything else. And so if you're not strengthening the muscles the right way, then you unfortunately are kind of walking that path. Now, here's where it gets really exciting. Just because you have a permanent injury, you can strengthen the muscles. You can repair and replace and reposition your posture so that the weight of the head, the balancing on the head, is not going to overwhelm the incapability of the ligaments. Your body can do its job to actually hold things together, but you have to do your part. You have to strengthen the muscles, and it's not as simple as just going to the gym and working out, because these muscles that surround your neck here, they help to turn your head. That is true. But what we're trying to focus on are the muscles that actually attach to the spine itself. You have 2 main muscle groups that actually attach to the spine. The first one is called the multifidus. The other one is called the rotators. These are micro-sized muscles comparatively to the big ones within your neck. So you can strengthen the muscles within your neck, but if you don't strengthen the muscles that are directly attached to the spine, you're kind of not getting the job done. Yes, you can improve your posture, but we're trying to improve it from a structural side. And so that is the point behind why we must focus on strengthening the muscles. And if you can strengthen those muscles and maintain that, be hyper vigilant for the rest of your life to keep everything strong, then you have a very good chance of having absolutely no symptoms or very minimal symptoms. And the arthritis, you could probably not have to worry about that either. But you have to stay vigilant. You have to push forward. You have to do the things to help strengthen the muscles to keep your spine in the right position. Now, yes, there are lots of different conditions that you can deal with. Yes, there are lots of situations that can cause other things. I understand that. But if you do your part to strengthen your spine, to restore the curve within your neck, to keep good posture overall, your chances of having minimal, if any, symptoms at all are incredibly high. And that's what we want. And that's why I created what I have called the Posture Academy. The Posture Academy has a program that is very specifically designed to help to strengthen the muscles within your neck, within your body, to keep your posture where it is. And so what I am doing is I'm giving away the first month absolutely free. I'll cover the costs on that. And the purpose of this is actually to restore, or at least get the momentum started, to restore the curve within your neck. And if we can restore the curve within your neck, then the rest of the stuff that you need to do becomes a whole lot more successful. And so I give away this first one so that people can at least get started. It's absolutely money back guarantee. So if it doesn't work for you within the first 30 days, cancel the program. Very simple if you don't notice any type of change. But I'll put the link down in the comment section below of where you can go and sign up for get your free month. It's 30 days of actual strengthening rehab for your neck. And now, the purpose of this podcast is to bring attention to those that have an injury and don't have a clue what to do for it. The point is to try to help everybody to improve their lifestyle, to improve their life, the quality of their life for the rest of their life. So in this podcast, I will be answering questions. I will be talking about different topics, but I will be answering questions that come from you guys so that I can answer them specifically for what it is, your concerns that you have. And I'll do it right here on this video. And so if you have a question, leave them in the comment section below. If you feel comfortable putting your name and information or of who you are, put it in the comment section below. But if you don't, then I'm going to put a link down below to our email, and that is podcast@thepostureacademy.com. And you can email me the questions there, and I'll be pulling from all these things. I'll be having questions, and we'll be talking very specifically about them and bringing everything all together. So that's it for episode number 2. This is the beginning of a long adventure for me to try to help more people than what I can reach within my community here by reaching out to everybody out there.